Thank you, Mr. Speaker. Today I stand in this House to introduce my private member resolution, which calls on the Government of Ontario to create a Childhood Obesity Awareness Month during the month of May as a part of its strategy to combat childhood obesity in Ontario. Mr. Speaker, I am introducing this resolution after consultation with medical professionals, researchers, educators, and young people, through which I was able to learn more about childhood obesity. From those consultations, I can tell you that something that we have all heard already. Childhood obesity is a growing problem that needs our concern. Mr. Speaker, childhood obesity is measured in young people aged 2 to 17. It can be understood as a preventable condition that occurs when children have an abundance of body fat. Simply, obesity results from imbalance when energy consumed is greater than that released. Childhood obesity has become an international crisis. The World Health Organization has stated that childhood obesity is one of the most serious public health challenges of the 21st century. According to the estimates, 42 million children globally under 5 years of age are overweight. In the UK, the latest health survey for England shows that over 1 in 10 children aged 2 to 10 are obese. According to the Government Commission Foresight Report, if no action is taken, 25% of children in the UK will be obese by 2050. In the United States, the childhood obesity rates have nearly tripled over the past 30 years. Today, the Center for Disease Control stated that 17% of American children are obese. In addition, studies have shown that 31.7% are obese or overweight. That means that more than 12 million American children and adolescents are obese, and more than 23 million are either obese or overweight. In Canada, we are facing a similar problem. It is estimated that 26% of our children nationwide are either obese or overweight. In addition, over the past 3 decades, obesity rates have tripled in children aged 12 to 17 in this country. Ontario is not immune to this childhood obesity problem. In her 2004 report entitled Healthy Weights, Healthy Lives, the then Chief Medical Officer for Health, the late Dr. Sheila Bassur, stated, quote, "An epidemic of overweight and obesity is threatening Ontario's health," end of quote. For Ontario, childhood obesity data is limited, but according to Statistics Canada, in 2010, 20% of youth aged 12 to 17 were obese or overweight. It is important to note that this statistic is based on self-reported height and weight data, which tend to be underestimated percentage of people who are overweight or obese. Concerns over childhood obesity rates has also been voiced in a study by Dr. McCrindle of the Hospital for Sick Children. Mr. Speaker, obesity rates among our children are at an unacceptable level. Ontarian physicians have warned that if this current obesity trend continues, we are raising the first generation of children that will not outlive their parents. It is for these reasons which we must address the issue. Mr. Speaker, as a nurse, I can tell you that when unhealthy habits are learned at a young age, they stay with the children into their older years. These habits can lead to worse health implications down the road. Evidence has shown that obesity in children contributes to the early onset of type 2 diabetes, heart disease, high blood pressures, chronic joint pains, several types of cancers, and breathing problems such as sleep apnea. These are chronic diseases that will remain with our children as they progress in their lives, preventing our children from living normal, healthy lives they should. And because of the social health risks, obesity has enormous economic costs on our society. In Ontario, the health impacts related to being overweight or obese cost Ontario $2.2 to $2.5 billion a year. Statistics also show that 75% of obese children will be obese as adults. Obesity cost becomes more expensive as people get older. Considering that over half of Ontario adults are obese or overweight, this province faces a threat of increases in health costs down the line with high prevalence of childhood obesity in Ontario. It is for all these reasons that I have mentioned that we need a Childhood Obesity Awareness Month. We need a month to educate and inform the public about the needs for all the needs of our children to live healthy, active lives. We need to use this month to help to alleviate the current crisis and prevent all our kids from developing unhealthy habits. Mr. Speakers, as part of my consultation to learn more about childhood obesity, I visited visited many schools in my ridings for a number of childhood obesities and healthy living roundtables. A number of schools participated, including Agincourt Collegiate Institute, Sir Alexander Mackenzie, some of my students are here today, Henry Kelsey Public School, Dr. Norman Bethune Collegiate, Kennedy Public School, David Lewis Public School, Terry Fox Public School, Lamourie Collegiate, Sir Ernest McMillan Senior School, Stephen Leacock Collegiate, Chester Lee Public School, St. Henry Catholic School. The reasons why I conducted these roundtables was because I want to hear from the young people who see childhood obesity firsthand or may be experiencing it. I want to hear about what they thought about childhood obesity, what are its causes, how must we deal with this issue. The students provided invaluable insight on this issue. They told me that youth today are spending a lot of time watching TV, playing video games on their computers. Some walk to school while many do not. Many eat unhealthy foods because it is advertised more in the media and is much easier to access. Students also told me that they are dependent on their parents to provide them with healthy foods. Our kids are more sedentary now than ever before. The Canadian Physical Activity Guidelines suggested that young people aged 5 to 17 should accumulate at least 60 minutes of moderate to vigorous physical activity daily. However, only 7% of young people attain this level of physical activity according to the Canadian Health Medical Survey. Our kids are also eating less healthy. The consumption of high sodium, fatty foods, and high sugar drinks all play a role in contributing to obesity in children. In a 2009 report by the Heart and Stroke Foundation on health of our Ontario kids, they found that only 13% of Ontario kids aged 6 to 12 eat a recommended 5 or more servings of fruits and vegetables daily. We need a Childhood Obesity Awareness Month to encourage our kids to be more active and eat healthily. We must use the Childhood Obesity Awareness Month to empower our parents to make healthy choices for their kids. Mr. Speaker, as part of my consultation on childhood obesity, I met with Dr. McVeigh and Dr. Ferguson at the Hospital for Sick Children. Both doctors emphasized to me the significance of mental health and how it contributes to childhood obesity. Negative body self-imaging and stress at home can contribute to unhealthy eating, binge eating, and a lack of self-confidence. In fact, this point was emphasized by my conversation with the students. Stress in a young person's life in schools or with the family may lead them to eat unhealthy foods. As well, students who are overweight or obese face bullying, and they are constantly bombarded by the media portraying of an ideal body. As a result, those young people lack confidence in one's body, isolate themselves from others, and can suffer depression. It is important that we use Childhood Obesity Awareness Month to promote positive mental health, confidence, and positive self-imaging in all of our children, so our children can have confidence to be healthy. It is also important that we use Childhood Obesity Awareness Month to encourage our schools to teach our kids the importance of living healthy, active lives. In my riding of Scarborough-Agincourt, many of our parents are new Canadians. They work long hours. As a result, the school is where the kids learn many of their healthy, active living habits. Because our school plays such a pivotal role, I'm proposing that Childhood Obesity Awareness Month take place in May. This will give our young people an opportunity to be in school and also enjoy the warm weather of May so that they can be physically active outside. Many of our schools in my riding are working to promote healthy, active living to our young people. We must also use Childhood Obesity Awareness Month to encourage our school boards to continue to motivate our students to live healthy, active lives. The chair of the Toronto District School Board wrote to me and stated that by working together and raising awareness, he believes, quote, we can help encourage physical activity and develop healthy eating habits in children that will last a lifetime, end of quote. We should also use Childhood Obesity Awareness Month to encourage our businesses, community groups, and sports teams to work in the communities to promote physical activities amongst our youth. Mr. Speaker, this government has already committed to combating childhood obesity in Ontario. The Minister of Health and Long-Term Care recently released the Ontario Action Plan for Health Care. The government will, I quote, aggressively take on challenge to reduce childhood obesity by 20% over 5 years, end of quote. I fully support this initiative by the minister. My resolution in creating Childhood Obesity Awareness Month will complement the minister's objective. To all members of this legislature, childhood obesity is a growing crisis that has enormous impact on our society, but most of all, impact on our young people. And I hope you will support this resolution so that we can use the month of May to raise awareness about childhood obesity and encourage all of our young people to be healthy and active. What they will learn in the month of May can be used all year round. It is the future of our children and youth that is at stake here. Thank you, Mr. Speaker.